Hi everybody, this is Dr. Ihab Abdurrahman, Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. We are still doing our session in patient safety. In this session, we continue discussion about culture of safety. It is about your role. How can you contribute to culture of safety? So my objective to describe several specific behavior you can practice to foster culture of safety in your workplace. If you work in organizations that observe safety and culture of safety is all over the place, from top management to mid-level staff to the frontline provider, then it is easy to be engaged in culture of safety. But sometimes you can be working in an organization in which culture of safety is not a major component of their practice. Even if you don't work in safety oriented culture, there are some activity you can do to spread the culture of safety. Actively set a positive tone when working with a team. Routinely use structured type of communication like briefing, debriefing, spark communication, call out, closed loop communication. And we have discussed this in another session about structured communication, about team communication. Learn how to differentiate between system error and unsafe behavior. And in this way, you can teach your staff about issues related to the system and activities that relate to their competency. Be respectful to all of your colleague and patient. So it is part of life. As you grow, you get more responsibility. So you supervise others. Even if you are just a house officer, you will be a senior house officer and then a medical officer. And if you are a junior nurse, then you will be a senior nurse and a matron. So seize the opportunity. Discuss error openly in order to learn from them. So let us see the factor contributed to the error. Are they personal or system factor? Encourage others to reflect and analyze error, NEMS. Agree on a specific language, also known as critical language, to be used when any team member has safety concern. So leadership is people get it with a title, and many people they have to practice leadership even without a title. Leaders without title. Every time you walk to talk to your patient, you are in a leadership position, and every time you walk with your peers, you are in a leadership position. So seize these opportunities. Always clarify the goal and understand your team member abilities and capability. Assign them a specific task, and encourage everybody in bi-directional dialogue and communication. Call them with their name, and if there is a concern, stop the show and listen to them. And if there is a need for training, address that and facilitate how they can improve their training. Sometimes situation force you to take a leadership position. Imagine you are in a clinical session or in the emergency or in the operative theater, and a senior colleague is bullying and intimidating. So people can remain quiet, but you have the chance to raise your hand and you can say, we are all trying to do the best and the right thing for this patient. I'm having trouble understanding one part of the procedure. So can you help me understand what we need to do here to be successful? That is being a leader. So you change the focus from being imprisoned on that sensation. So you try to deviate that person's attention to clarify what he wants and to objective and to measurable actions that people can do to improve their patient situation. I am sure when you come forward in such a situation and asking such a question, it is difficult and it could be scary. scary thing to do. You may even suffer negative consequences for speaking up in this way. But modeling good leadership behavior as respectfully as possible is the right thing to do for our patient. Another behavior that can foster culture of safety you can do is to be respectful to all of your colleague and patient. Everybody think it is easy to to respect all of the people surrounding you. Most of us to be nice to the others. It is not just a matter of being nice for its own sake. It's about patient safety because lack of respect can jeopardize patient safety. People, when feel they are not respected, they become violent or silent and they don't come forward to address safety issue. If you work in healthcare, you must be approachable so people can come to you, they can discuss the issues with you. But if you are having a bad day or you are feeling rushed or someone just done a lot of work on you, or even if you are sick or you have a family issue or you break down with your fiance, so you don't have to take this with you to work. A lot of things can put you on a rotten mood, and it is hard sometimes not to take that out. It's hard sometimes not to take that out on other people. So you need to remain respectful to everybody around you. Disrespect between teammate or between caregiver and patient is probably the greatest source of harm to the patient. Within 5 seconds of your entering a room, your teammate and patient will know whether it is safe to speak to you and voice concern or whether they just need to keep their head down and stay out of trouble. In short, if you are being rude and disrespectful, you are creating conditions that are extremely unsafe for your patient. Make a point of treating your patient and co-worker the way you would like to be treated, and your care will be safer as a result of that. This is the golden rule of Essex: treat people the way you want to be treated. When managing other, sometimes we need to agree on a specific language. Also, this is known as critical language, to be used when any team member has safety concern. When people are intimidating or difficult to approach, their teammate may rely on what we call hint and hope method. Hint and hope method. Rather than saying, hey, we are about to operate on the wrong arm, they might instead say, this is the correct side, right? Maybe we are operating on the wrong side. The problem with hint and hope is it is indirect and easy for the others to ignore. It is not a reliable way to stop the process that is going in a wrong direction. So, in culture of safety, team will agree ahead of time on a critical language, essentially a code word. There is a specific word. When they hear it, they stop the show. Uh, Stop and talk to me. I think we have a problem. One common example, I need a little clarity. When you say I need a little clarity, it has the advantage. This phrase, you can say it in front of other team member and in front of the caregiver without unduly alarming them of embarrassing their colleague. In aviation, they use this word CUS, CUUS. It's about I'm concerned, I'm uncomfortable, I feel unsafe, I am scared. When you voice any one of these four words, or even if you say cuss, people they stop the show and try to address the concern. So whenever any member of the team says that he's confused, uncomfortable, unsafe, is scared, team leadership should clearly define it as an expected behavior. So they stop the show, and then they should reinform that message as often as possible. So you encourage them to come forward and to voice this concern and to speak about any alarming situation. And after we clarify, then we can proceed. Transparency, it is a culture that when we can come forward and openly uh, discuss error and learn from them, we should encourage others to do the same in all other situations. For instance, imagine you are a house staff, supervisor at a hospital. When a new group of resident or nurse show up, you might show them list of common medication error. Like for example, I notice for example people sometimes they confuse propranolol with pantoprazole, although they are using different things. But sometimes people they read the first, or sometimes dopamine and dobutamine look alike, sound alike. So if you alert people about this situation, and also you advise them to focus on any errors that happen during their practice, so the organization can learn from them, then you might say here how each of these error happened, and now we are going to learn from them, so it will be easy for you to avoid making such mistakes in during your practice. Another way to model transparency is to talk about your own mistake openly with your colleague. If you committed an error or an EMS, and just when you discuss it, they can know that even senior colleague, they can make error and we can learn from them. It takes confidence and humility to admit your own mistake, but it is powerful for others, particularly those who are junior to you, to hear and do so. To assess culture of safety in your organization, you can ask these questions. Do leaders here in this organization create an environment in which you feel safe to speak up about error? When someone voices concern, do people stop, listen, and validate it and make corrective action? When you do voice a safety concern, do people senior to you act quickly to remedy the unsafe situation? Do you know how to tell the difference between unsafe behavior and unsafe system, so you can differentiate between individual accountability and system accountability? Do people openly discuss mistakes? In this case scenario, fourth year medical student was in the internal medicine service. She was taking care of an elderly woman with chronic pulmonary disease, COPD. The patient was not doing well. She has tachypnea and she was short of breath. And she went to see the two residents in the conference room, but they were, when she went there, she found them arguing over how to change the plan of care. Uh, so everybody knows these residents, they don't go along with each others and they are very competitive. They were yelling about literature, and the student said, I couldn't get a word so that she can address patient situation. Meanwhile, the patient was getting worse, and the student didn't know what to do. At that moment, in this situation, the student, she assumed a leadership position by reframing discussion around the common goal. She said, I know we want to do the right thing for Miss Jones. While we are having this conversation, her breathing is becoming difficult and worse, and she's tachypnic and hypoxic. Can we go to the bedside and do what we need to do to help her right now? I am worried that she can arrest or stop breathing. So, um, your role to improve the culture of safety, it is possible and simple for you to do a lot every day to make care safer and you can do it in a small scale. To influence the staff and patient around you, you can actively set a positive tone when working with a team. Routinely use structured type of communication, briefing, debriefing, spark communication, call out, close loop. Learn how to differentiate between system error and unsafe behavior. Be respectful to all of your colleague and your patient, and thank you.